You got it.
So
What you'll
everybody,
have,
this is
oh, go
Esco
ahead.
Buff. I'll let Esco do a more formal bio and background if you want to, but I'm going to put you in the driver's seat, Esco, and the screen share is ready for you when you're ready.
Perfect. Just 1 second. Okay.
And I'll mute my audio as well.
All right. So I am Esco Buff, been a farrier for just over 50 years. Most people can just do an internet search to find out who I am. I've written books. I lecture all over the world in the Hall of Fame as well. And met Christina through the AATT. And we've been conversing, as well as she got to see some of my clinics at our convention. So I'm here to present some of that information to help you guys out as body workers. So one of the things that I think a lot of people who work on the horse don't understand is how much the farrier can actually affect the entire body. One rasp, one little swipe on one side of the foot can change the entire muscle structure on the horse. And this is really important to understand, because as body workers, you could be chasing after things that are being caused by the farrier, and you're not having as much success with dealing with that. So what we're going to talk about, I got 2 little short PowerPoints to talk about, and I'm always open to questions along the way. The first one is going to be on balance that we're going to talk about. Did you share with me?
You should be good. Can you? Is it not letting you share? There we go.
There we go. Let me pull up this PowerPoint. And be free to ask questions along the way. This is sort of the definition of what balance is. Blah blah blah. Balance is a relation of harmony between the parts, whatever that means. This is the definition. And basically, what we do to study balance is we actually study imbalances, because if there's imbalances, it shows up in hoof distortions, remodeling, and things like that. And that's how we determine balance. And of course, it's greatly affected by everything: weight bearing, conformation, environment, rider, everything. One of the things that if you want to test your farrier is, or a farrier is, ask them if they can keep a horse in balance. No farrier can keep a horse in balance. We can balance the horse at that moment in time, and then everything that the horse does, from preferred stances, preferred sidedness, ways ridden, environment, everything always is affecting the balance of the feet. So there's many ways to balance a horse. Various techniques. They're based on methods of observations or devices. Oops, let me go back. Let me figure out how to go back. There we go. The problem of balancing arises when balancing technique becomes more important than the observation. So some people will stick with a technique, and even though the feet are getting worse and worse, will stick with that technique without changing it. Now, we measure balance in 3 dimensions, X, Y, and Z. And we'll talk a little bit about them. The 4th dimension is a tesseract. And what we this is over time. So when you show up at a horse and you look down and look at his feet, and it's been 4 or 5 weeks since he's been last trimmed, what you see is the consequences of all the imbalances in his body and his feet. Now, there's lots of techniques. There's the T-square method where people use a right angled T and look at the lower leg and see if the hoof is in balance. And on this picture here, if you're using this, it would show that the right side of the picture is higher than the left side, so he would be in balance using this method. You got hoof mapping techniques where there's a couple different ones where they draw different lines and proportions on the bottom of the feet from different places, because there's several different techniques, and then they balance the horse's foot this way. There's Duckett's dot from Dave Duckett, a farrier, who people will balance the feet around Duckett's dot. This is where some of the hoof mapping came from. There's sighting methods where farriers will sight down the leg. And of course, this is on a variable of how you're sighting. There's a coronary band method where you sight where the coronary band should be parallel to the ground. Phalanx angle alignment. This is where you look at the side of the horse and you determine if the leg is straight from the lower phalanxes. So that'd be the P1, 2, and 3, or the coffin bone, short pastern and long pastern. Radiographically, you can look at joint spacing and determine if a horse is in balance. The whole horse method, looking at the horse differently. It's a sighting method, but looking at it differently. So the problem with a lot of these techniques is very few actually look at the entire body to observe the balance. Several techniques look at only the leg from the knee down, ignoring the rest of the body, like the T-square method, or they just look at the sole of the hoof, like hoof mapping, and look at parts of the body that are not meant to be balanced, like the coronary band method, or look at body parts that more often deceive our eyes, like phalanx angle alignment method, or look at incorrectly taken radiographs. So basically, there's a lot of problems with a lot of the techniques, and they're all based on theory. No one technique has been proven to be better than the other. Certainly, certain techniques have been ruled out to be worse. So let's just talk briefly about them in case you run into them in the field. Some people will use the coronary band and say, okay, coronary band should be parallel to the ground. So in this picture, you look at it, and the coronary band is not parallel to the ground. You'll see that the inside, or the left side of your photo as you're looking at it, looks higher than the right side. Interesting, this was a California case that I got called into. And the vet got to pay the farrier bill because he lost the bet, because I said, oh, I need to take a little bit more off the outside. And the vet thought I was crazy because he said, that's going to put coronary band way out of balance. I says, yeah, but his limb is out of balance. And he said, well, I'm going to shoot radiographs to prove you wrong. And I said, well, you prove me wrong, I'll double the, I'll walk away and not pay this person's farrier, or charge the person for the farrier bill. But if I'm right, you pay a farrier bill. Well, he paid the farrier bill, because here's a line drawn on the coronary band, and here's his radiograph. So if you take a look at the radiograph, the coffin bone is not parallel to the ground, and you can see the joint spacing is closed on the outside of the foot. Therefore, the animal is outside high, or lateral high, because it's not meant to be parallel to the ground. When they study horses, they found that only 45% of horses have a coronary band parallel to the ground, because it's subject to the limb distortions up above it. how the animal weights its leg and all sorts of issues, including injuries. There's the
Esco,
coronary vein. Yes.
raising my hand here. Is there a way, without radiographs, is like you just looked at this and knew? Is that from just your years of experience, or is there something in particular you saw that said, I can tell that this is outside high?
It's going to be by looking at it by the whole horse method, which we'll
Okay,
talk about, which you were exposed to at the
yeah,
convention. So you can see the bottom of the coffin bone is still outside high on this. So very deceptive. Our eyes can be very easily deceived with this stuff. Phalanx angle alignment. This is often used by a lot of farriers to align the hoof pastern axis or phalanx angle. Phalanx angle is actually the alignment of the three bones via radiograph. Hoof pastern axis is just lining it up visually from the outside. So here's a line drawn down how a farrier would put his rasp or something along the side of the foot and say, oh, he's in a line. And then the little squiggly line going down is the outside of the hair and hoof. So you can see that they seem to be somewhat parallel. So the animal is in alignment. Radiographically says something different. This animal is extremely broken back, which means that the bones are no longer in alignment with each other. You wouldn't know by looking at that unless you took a radiograph. Now, there is ways to overcome this. We teach a palpation method to palpate it, but we're not going to talk about that right now. And here's another case. You look at it and say, it looks like they're fairly straight from the fetlock down to the hoof. And when you look at it, he is fairly straight. Now, you'll notice that he's slightly deviated up at the between P2 and P1 at the pastern joint. This is normal, just so you know. This is actually a normal phalanx. It's very rare that the alignment of the bones is perfectly straight. They find that 2 to 4 degrees is what the normal horse is overall. So when you look at a radiograph, this is actually normal. What about this foot? This is one of a horse that I kept sound for almost 9 years before it developed laminitis, and it was decided that at that point the owner wasn't going to put the money into it. You can look at it and visually you can say, well, it looks like it's broken back. Well, it is, but what you don't realize is how broken back it was. This is an animal that got pinned early from a fracture, and this is how the coffin bone was in the foot. So that's pretty significant, more than what looks like when you're looking at it. So this is how easy our eyes can be deceived. And then you got this. This is Lily, a donkey I worked on. She doesn't have a coffin bone, so you can't get any alignment out of that. And she's perfectly sound to this day. Why using a T-square or lower leg sighting may not be accurate. This is lower leg sighting is where farrier puts his head underneath the horse and sights the leg basically like a T-square. And you can see from the picture on the left, they're looking obliquely across the leg and they pull the leg out, or they shove their head underneath and are trying to look underneath the horse. But generally what happens is the leg is not underneath the knee. So therefore it's not in the correct position. And then you got legs like this. You want to tell me how you're going to sight and what is balance on legs like this that are going off in every different direction. Got all sorts of deviations here. This is where all those lower leg methods are not going to work at putting an animal in balance. And here's an example of an animal that was perfectly T-square balance, but he wasn't when we looked at him holistically. And you can see when we took radiographs, he wasn't in joint space balance, and you can see the cracks on the outside of the foot because he has a landing loading issue going on, because he actually technically wasn't in balance. Anytime you see flares like on this feet or cracks like that, they're generally a loading issue where the hoof is being overloaded in that area. and you should be suspect of a horse not in balance. Why not using radiographs may not be accurate. I teach radiology. One of the few farriers in the United States that actually carries X-ray equipment and shoots radiographs on horses. And vets do not get any radiology training at school. It's a point and shoot system, so they're often inaccurately taking radiographs. There's a lot of things that can go wrong. So here's a radiograph on the left of the foot on the right. And you can see it's quite two different presentations of the balance. You look at the one on the right, the picture, and it's you can look at it and say, well, it seems fairly balanced. And then when you look at the radiograph, it's a different story. And a lot of this is because it's not positioned right. The veterinarian hasn't positioned the limb, the radiographic equipment to the limb. And so in the radiograph on the left, you can see 3 holes, 2 in the bone, coffin bone in the middle. I don't know if, do you see my pointer or no?
We do, yes. We can see it.
Okay, here's 2, and then here's a third little one, and there's none over here. So that means the X-ray beam was not focused perfectly in the middle of the foot. This marker is exactly in the middle of the hoof wall right here, and you can see it's not in the middle of the bone. So the radiograph was obliquely taken, and therefore it looks like it's out of balance a lot more than it is. And this is how you have to have a great understanding of radiology to understand that this radiograph was taken incorrectly, and therefore a farrier or anyone looking at this, oh, he's high on this side and we need to lower this down, when that may be not true because it's the radiograph error in the taken. So here's a radiograph of amount of imbalance to change the joint. So if you take a look at the radiograph on the left, you can see, and the right, you can see all 4 formica holes. 1, 2, 3, 4, 1, 2, 3, 4. And you see the difference between the joint spacing between each one of them. Okay. What's the difference between those radiographs? Is if you take a look at the bottom of the foot, all it was one swipe of a farrier's rasp to change that joint space that much to get it in balance. And so it takes very little for a farrier to change a joint in the lower leg when rasping the feet. And so it's highly critical that the farrier gets balance correctly, or attempts to. So what is the best method? Well, it's going to be the method that we taught at Meredith Manor, and it is being taught, and it's called the whole horse method. Basically, it incorporates a larger view of the horse. So, and understanding that things in the upper body affect the feet as well. So what are the difference? The differences are I look at a horse differently. And also too is you're taught as farriers, you can't statically and dynamically balance a horse. So statically means standing still, dynamically means in motion. They say it's impossible. And so farriers balance them statically, but in dynamic, it may not be true. I actually think this is a false assumption, and I think it's based on the improper ways that people have been balancing feet. That's pretty concerning when you say that you can only balance the horse when he's standing still and not in motion, moving along. And it's actually been proven that when we holistically balance a horse's foot and when they're running that we can keep, that the balance is the same. So it's actually the technique that matters. And again, it's based on the, the misunderstanding of how balance is occurring. All right, balancing the hoof. We'll get through that. Basically, when I come into a horse, I look at the upper body. I study their spine. I went to chiropractic school as well, and I look at how the animal is standing there and their posture. That is going to tell me pretty much how their balance is in their feet. And if it doesn't line up, then I'm looking for something in between that is upsetting that. But how you stand is going to tell me how your balance is. In human chiropractic, when you come into the office, we can tell you by looking at your shoes that you're wearing all the time, which shoe is going to be more worn, either on the inside, outside, at the heel, or the toe, before we lay you supine on the table, because of how you're standing and walking. And this should be the same thing for a horse. Now, we can affect that through farrier work as well. Now, when looking at the horse, basically you should be able to drop plumb lines down, and where the attachment of the leg is, the middle of the hoof should be. And if it's not, then you're going to have some issues. Now, what's interesting about these pictures that you see in front of you, Gobot and Barrier had done these. There was actually a third person in this study back in the 1800s, and he was kicked out because they told him he couldn't properly use a tape measure or angles. He was measuring both sides of the horse, and he wrote a treatise later in German. And why the Germans also follow a limb length disparity whole horse method is because he was realizing that 60% of horses had different left body measurements than right body measurements. And so what was the start of some of this holistic stuff was back in the late 1800s. But the important part here is not as what is ideal, which, you know, they show as number one being ideal, number two being underneath, and three being forward. It's mostly to understand, if you're looking at this, how the structure of the bones change and how your muscle structure is going to be. Now, a farrier can take any of these postures can take any one of them and make them better or worse. I can take a horse whose number one is perfect and make them look like two or three by how I trim and shoe the horse. Whether I short shoe them, whether I roll the toe of the shoe, all these different things we can do, we can change this posture. And if we can change this posture, it changes the musculature system up above on the horse, which you guys will see or feel up above. Same thing goes for hind end conformations, which most farriers don't focus on. I focus a lot on the hind end. This is the powerhouse of the animal. The front legs are the support system. So I follow the hind end very well, and work a lot at trying to change a lot of the hind end postural issues of how they're standing. And then they do the same thing of dropping lines from the front and hind. And of course, this is the only perfect horse that I ever see right here is in this picture, because they don't exist.
I appreciate you saying that, so that they know that they're never going to see the perfect, because it's not out there.
No, if you do, you better take pictures, document, and call everyone in the world, because it doesn't exist. And none of us are perfect, and no horse is perfect. The goal is to deal with the imperfection and get it closer to perfect, but it ain't out there. Body imbalances. So here's a horse up on a step ladder looking down. This is the number one reigning horse in the United States. And basically, how are you going to deal with this animal all of a sudden starting to lose its performance? You know, there's
Is it, I mean, I look at this and my brain goes to, is it truly a conformational, like bone to bone length, um, dysfunction? Because it looks very postural.
well, we're going to get a lot into the word conformation and posture shortly into the second PowerPoint because it's a term that our industry uses incorrectly.
I
Uh,
agree.
um, but uh, the basic the basic definition of conformation is things the animal's born with that can't be changed, eye color, things like that. Posture is both acquired through how the animal stands and how they deal with their tabletop, the top part of their body. Um, the cases like this horse had flown in some of the top chiropractors and massage therapists, and the horse's performance wasn't changing. And all it took was a 1/4 inch leather pad underneath the left front shoe to completely change this horse's posture and put his performance back to normal. And if you take a look, you can see the curvatures in the neck. You can see it, the withers are different heights. You can see if you divide this horse in half, the tail and pole don't line up very, if you draw a line from tail to pole, you can see there's more mass on one side than the other. And so this shows up in the feet as well, but this is an issue that a farrier can change. And as a massage therapist, you can be chasing um, real tight hamstrings, glute muscles, scapula muscles, even longest muscle will be tight. You'll have some neck muscles that'll be issues, uh, semitendinous muscle issues, and will be issues with this horse. And you will be chasing these and doing work after work on them, which is fine. It makes you money, but you having a difficult conversation about how been change this posture will help relieve a lot of the musculature issue going on. And this is an infamous one that I'm well known for, because for 1,000 years, farriers have been dealing with high, low, or a club foot issue, and they keep doing the same thing, and no one's been able to change it. You know, they keep lowering down the heel on this club foot, and lifting or putting a wedge pad underneath these crushed heels, and nothing changes. It continues to get worse. And of course, this club foot overnight just grows right back, kind of deal. Whoa, decided to take off. And this is an issue that's, well, I love the quote Einstein, keep doing the same thing over and over and expecting a different result. This is an easy fix, and all it requires is understand that this is not a hoof or limb issue. It is an upper body issue with legs with different scapula heights. And so this doesn't belong to the horse you just saw. But again, here, in order to put this animal in balance, this actually was one of our Olympic horses, and it required a 2-inch lift underneath this left front foot. Now lives in a 1/2-inch lift and is perfectly sound to this day, but that's as much as we could change it. Its scapula height, when you measured the top of the scapula, was 5¼ inches difference, which is huge. And also a testament to the horse that his performance could get him that far in life before he started to break down. Hoof differences. If you look down when you're doing massage work and see 2 feet with 2 different looking feet, like this, Here, farrier trying to fix this crack and not understanding this is a loading limb right here. This is an upright, shorter limb. Any foot that's more upright is narrower because it's trying to grow heel, and this one's plattering out. And it's creating toe cracks because of the force, the loading force. That when you have different size feet, then there is a landing and loading issue. Just like with people, you'll have two different size feet. And one is because you have a landing and loading issue. You're preferring to heavier land one foot more than the other. And that can be for multiple reasons. Now, the feet, there's actually 5 hoof patterns, coffin bone patterns. And the 5 hoof patterns were first discovered by Scott Simpson, excuse me. And radiographically, they proved that there's 5 shapes of coffin bones. Norm, after a normal front foot, a spike, just sort of like the toughest kid in the block because he had the hardest time making that shoe. It's more like a Morgan's foot or an Arab's foot. It's a little broader across the toe, a little straighter in the quarters. A stubby, which is like the thoroughbred and young quarter horse feet, which it looks like someone took a norm and put it in a vise and squashed it. It's wider than it is long. A tag for the normal hind foot, and a Ralph is a combination of any of the other 4, which we believe Ralphs do not occur until the age of 2 or 3. So we believe they're acquired. They're not born with it. The coffin bone changes shape because of the loading patterns on the coffin bone as it's remodeling. So when you look down, if the feet aren't the same, you're going to know the body is not weighting the same. So when we balance the horse, I always start with the hind end, mostly because this is the powerhouse of the animal. And when I start in the back end, we can reduce a lot of the issues that occur up front in the musculature and the legs. And also, too, halfway through, they always take a dump. And so you already got the back feet done. So you don't need to worry about picking out crap out of the back feet. We sight the leg from looking behind it. Now, we do not, most farriers, if you watch a farrier, they'll pick up the hind legs and sight down the leg. This is actually impossible to do, and it shows the lack of education that the farriers have been learning over the years. Because the tibial tarsal joint, once the leg is unloaded, if it's loaded, the stay apparatus has the leg completely straight, and the tibial tarsal joint. But once it's unloaded, that's 15 to 20 degrees that the leg will immediately bend outwards or the hock inwards. And so when a farrier picks up it and is sighting down the hind leg, they're actually sighting a crooked leg. And over the years, the last 10 years, we've been focusing a lot of research on a lot of hind end lameness issues. And I believe most of it has to do with the fact that as farriers, we've been putting horses out of balance by sighting down the leg. And that's why a lot of horses have been problems. So what we do is we stand behind the horse. And when they're both feet are somewhat together and we're sighting down, we're dividing, we're putting our chest in the middle of the leg and we're looking down the leg and we're looking to see where the fetlock drops down in the leg. And basically the fetlock should be dropping equally between the heel bulbs. And if not, you're going to see more on one side of the back of the hoof than the other side. It's a little bit of a technique that it doesn't take much to learn. I mean, I taught Christina it, so it's easy enough to learn. But it is a technique to accurately assess that. The front leg balancing, it's all about proper picking up the limb and body position. So when we pick up the limb, we want to bring the limb up with our outside hand and our hand at the fetlock so we don't interfere with the joints moving, and bring it up to the elbow in order to sight the leg. And basically we're looking down in this position on the leg and we're dropping the foot down. I have a 3-second rule. Within 3 seconds, you need to determine the balance of the front feet. And there's a reason for that. Because if you spend more than this is like a picture on the wall, you go and look at a picture on the wall and you say, oh, that side's high. And then you start studying and like, no, the ceiling is not level or this is level. And now you're talking yourself out of things. And that's a switch between the right and left brains. And that's just normal. So you want to do this within 3 seconds is determine which side of the hoof is high and low. And then from there, you'll understand then at that point what part needs to be lowered. Any imbalances in the feet will show up in that entire leg and entire musculature. Now, if you want to practice sighting an animal, I had found this out back in the late 70s, early 80s, because my horse stepped on some chalk, is if you just take some sidewalk chalk and chalk the hoof front and hind, and just chalk that hoof wall, and then, or if it's got shoes on, chalk the shoe, and walk them in a straight line for about 40 feet. Do not turn them, and pick up the horse's feet. The horse has a natural slide when it lands its foot on the ground. There's a slide. It's not a stopping. There's a slide. So if there's a high side on that foot, it is going to wear the chalk off in the parts that are hitting the ground first. And this can be a very good clue for one to determine if the horse is in balance, and two, how it's going to affect the body up above. All you have to do is put a wedge on one side of your foot and feel the difference in your body, and you'll be able to see that in the horse as well. This is different research. I throw in here to show you that it's not just anecdotal we're talking about. This has to do with hoof spread and unequal loading of limbs. This is on hoof shape and how it affects the soundness of an animal. Skeletal forelimb measurements. As far as limb length disparity, which was one of my books I've written on that I'm known for. Now, to end this one PowerPoint will be a case study. This was a Mississippi horse, a yearling, that I got called in, a 1.5-year-old animal I got called into. And this is an animal that would normally go for a couple $100,000 at the yearling sales and stuff. All the people in the picture are vets from the university because they were going to do a check ligament dystotomy, cut the check ligament on this horse because that's all they know. And this is what the horse looks like from behind. And of course, Esco comes in and says, oh, a farrier can easily fix this. You don't need to cut any ligaments. This is what his front feet looked like, sort of fell apart. This is what it looked like from the side. So you can see the right is extremely clubby. So I put a shoe on the left front just to protect it and get some good hoof growth out. You can see how much worse that the clubby foot got because we lifted up the left front. That should be your first clue. We actually made it worse. And so there it is. And so I put a stack of leather pads on. And so this was at the end of day 1. So here's before trimming and shoeing, and this is after trimming and shoeing, same day. You can see there's already quite a relaxation of the collateral ligaments in the leg. The alignment is a little better. It's really nice that this animal has a striped foot because you can actually focus on the stripe to even see the angle is much better. This is 5 weeks later, I show up. It's no longer growing as much of an upright foot. So that's day 1 and 5 weeks later. 10 weeks later, not my beer can in the back. This is what it looks like 10 weeks later. So we can greatly change the upper body as a farrier. Now, knowing that a farrier can greatly change that body is half the battle, because the hardest part you're going to have as a body worker is, if you're seeing issues in the feet, is actually having a conversation with the farrier about what to do. That's not an
That's a
easy
fact.
conversation. Yeah. I personally am a professional farrier, and so I always enlist any conversations with any other professional working on the horse. It doesn't mean I agree with what they're doing, but if they can explain it to me and what they're seeing and what they think, we can have a discussion about it. That doesn't happen with a lot of farriers, because you're going to find out dealing with your farriers, there's a major ego issue out there. You're not going to be able to tell them what to do. And in essence, I always also say you shouldn't be telling them what to do. What you can say is, this is what I'm observing. Is there anything you can do to change that? And you put that back on them. They either say, no, it is what it is, or yeah, there's things I can do. And then you have an assessment point each time. But that's another whole PowerPoint on that. How to address consequences of postural issues. Well, when equine conformation is discussed, it's often interchanged with the term posture and vice versa. What we really need to do is define these, so we're not using these terms incorrectly. And I'm noted in the field for doing this. Dr. Frank Riley and I in January will be doing a lecture on cornitis, and it's often called CBD, coronary band dystrophy, and that's an incorrect term, and we take a hit for putting the lectures out, because of the fact is they're actually using a term that has nothing to do with the disease. It's not a muscular disease. Nothing's been proven. It's not a nutritional disease, and nothing's been proven. And in the equine industry, people will make up terms just for the heck of it. They should have a correct medical background in it. So let's look at that. So here's all our legs that we see in books, and they always say, these are the conformation of the horse. None of these are conformation. None of them. This is posture. Every one of these issues, if at 3 and 4 weeks starting of age, a farrier could have helped balance them up or do things to the feet in order to help these limbs out. But it's actually voodoo for farriers. I work on foals that are 2 and 3 weeks old, and we straighten out leg issues all the time. But what happens is most people wait till they're 3 months, 6 months. And then what happens is these postural issues become permanent. So conformation, oh, go ahead.
Oh, I was just going to ask, can you also share, because that was one thing that really stood out for me when I took a class up in at conference, how when they're that young, you encourage really every 2 weeks.
Yeah. Every 2 weeks, I'm working on the horse. If not, I'm getting the owner to do something. At birth, the bones have the piezo plates in them. And so what happens is they mature and fuse as the animal gets older. And birth, it starts at birth, and some of these are fusing at 1 month, 3 months as you go up the leg. And so it's extremely important that if you don't understand, that you understand that if the animal is not equally weight bearing on that limb, the appeasal plates are not going to fuse in a straight line. They're going to fuse crooked, and then you'll have a rotational deviation for the rest of the animal's life. And we'll talk about that a little later too. And so it's extremely important to keep those balanced and those legs as straight as possible. And if you can't do it through trimming, do it through glue-on shoes, which we use a lot of them on foals, in order for the legs to be as straight as possible. The least amount of deviations we can, the more we can prevent deviations or lessen, the better the animal will be, and the better his performance and life will be later on. So conformation refers to the basic physical structures and characteristics that the horse is born with. Maybe. Characteristics stem from breeding, such as eye color, eye set, nostrils, ear size, density, length, size of bones, and skeletal structures. Principally, it's the size, relative orientation, and length of body segments. However, this can be influenced by some external factors, such as diet, exercise, and stuff like that. Posture is how the horse organizes itself or stands. Posture is acquired. Posture is determined by soft tissue structures. These structures can be changed positively or negatively, that's for sure. Poor structure increases risk of musculoskeletal injury and other issues. When we were talking about bones fusing, there's a couple bones I focus on because I deal with a lot of OTTBs. A lot of people don't understand that it takes 4 to 5 years before the sacrum fuses in the horse's spine, and often we'll get subluxations and misalignment of the sacrum, which immediately sets the animal up when it fuses for issues in its hind end then after. And so that's why I focus a lot on hind end, because it takes longer for those bones to fuse, and the more I could focus on that hind end and making sure that the sacrum's going to fuse straight and the pelvis is going to fuse as well as with the least amount of stress, it's going to make the animal's life a lot easier than after. The biggest difference between the two is that conformation cannot be changed. However, posture can be changed or improved or made worse. So looking at the horse's posture and how it transfers its weight while at rest provides us with a lot of important information as a farrier. Observing the horse at rest is important information. It tells us if something's going wrong, of how they're transferring their weight. We deal with this with a lot with laminitis cases. When they're in a lot of pain, they're pumping their feet, they're moving back and forth and transferring weight a lot. If they're buted and given pain masking drugs, they're not moving at all, which is not good. But we keep track of how that animal is shifting its weight, because it tells us a lot about how the animal is compensating and if they're in more or less pain. This is just go through here and just let me put this on the others. Let me minimize this here. Your screen's in my way. Obviously, when we're looking at abnormal posture, we're looking at all these issues. Same things that you guys are looking at. Most farriers don't look at this, but I'm looking at it because I'm a lameness specialist. So I'm coming in and trying to deal with lameness issues. So I'm looking at all of these issues and how the animal is compensating and figuring out where the insult is coming from. Obviously, we can do all these things to improve posture, but what can the farriers do? Biggest thing is trying to get the farrier to observe it and provide corrective farrier work. So these are different consequences of postural issues, that we'll talk about. Rotational deformities, angular deformities, axial, quadricular issues, or quote unquote navicular issues, and so on. Now, rotational deformities are described as an angular angulation around a longitude axle. Sort of irrelevant. Basically, what I want to, we have valgus and varus. So I always remember valgus because it's shaped like a letter L when you look up front, and vargus are knee knocked or out. Just to give you an example. Now, farrier can greatly help and change these things. This is what a radiograph looks like. So what's happened in this is this horse was not correctly balanced in the beginning. And so where it could have been, and so what happened is when this appeasal plate sealed, it's now creating an irregular bone tilting on this, so the joint is not square. Axial deformities are medial or lateral shifts of the articular surface. So it looks like they're bent like this. They're actually not that way. It's just a weight bearing issue, but literally the bones aren't bent that way. Here's a picture of the horse like that. There's another one. So it looks like they're bent that way, but in reality, they're not. It's just the way the legs come down to the joint. I deal with a lot of rotational spiral intorsions or extorsions, both of them, which are twists in the legs. So here is a dowel that we put through in the middle of a bone, and you can see that they're not pointed in the same direction. The whole bone is twisted. And there's a leg picture of it, and then another picture of an animal that has spiral intorsions. This is a weight-bearing issue created when they're young. And of course, the bone, as it hardened, stayed that way. And so now this is a lifelong thing. Unless we break the legs with a pipe wrench them out, there's no way you can change this. So it's something we have to deal with. And it's something we're going to talk about a little bit, because there's things farriers can do to help out some of the consequences of that. There's rotational extorsion, where legs go to the outside. And there's things farriers can do on this young horse to get these legs straight. My Facebook page is full of case studies like this, where you can look at different cases I've done and see how we've dealt with them and improved them. We don't need to go through this. Basically, here's looking at an extorsion. So what you see in the picture on the left, if you draw a blue line at the back of the heel bulbs. Come on, pointer. One at the end of the heel. You can see that they're not parallel to each other. The red line is where the frog points to, but the yellow line is the middle of the leg. So you can see nothing is straight on this foot. And you can see actually the consequences of some of this, this barefoot horse, of the weight bearing differences. And that's going on. We're going to talk a little bit more about that later. We're going to skip through that. So generally the second phalanx fuses after 3 months of age. That's P2. P1 is long pastern fuses at 6 months. And the third metacarpal at 9 months. So you have to work quick as a farrier to change these things, or it's too late, which most farriers aren't even looking at horses until they're a year old, or minimum 6 years. Negative phalanx angles, we talked about this, of how picture on the left is HPA, hoof pastern axis, which we talked about. The one on the right is phalanx angles. That's how you do it by radiographs, lining them up. What we're talking about here are negative phalanx angles, and you can see the consequences of what it does to the hoof. You can see that this foot is short shod and the toes are long. And so what this does is, because of this, it creates a, excuse me, I got to take a drink of water. 1 second. It creates tightening of the deep digital flexor tendon, which then tightens up the deep flexor muscle and the chest muscles. So I'm sure you guys have worked on horses with negative phalanx angles and HPAs and can feel the differences. There's things a farrier can do to change this. Same thing goes for this.
I think one thing, can I add something here as far as it
Yes,
relates to all of us
can.
out there practicing body work? Most of your body work programs are going to kind of dismiss the feet, saying that it's out of your scope of practice. And they're going to, even when you're out there, you'll see you've had body workers work on your horses, you guys are working on horses, and most people don't pay much attention to the feet except as they see the horse standing. They'll look at how the horse is standing, toed out, whatever, but they're not picking up the hoof and looking at it. They're not looking at how the hoof is growing, and they're not taking that into consideration as the body looks at a whole. So what Esco is offering here is it's pretty invaluable as we progress in this program and you guys get out there and start seeing more clients.
Yeah, and I would tell you it's definitely in your scope, because of the fact is, if something's causing body issues and you're coming in to work on the body, your job is to identify the insult that's causing these issues. Could be an injury, could be overwork, could be the horse just being stupid out in pasture, also could be the feet. And so better understanding of the feet helps you understand what you're trying to combat.
And whether you're going to be chasing your tail every time you go back out there because it's not getting corrected.
Yeah, amen to that. I want to show you some examples. Okay. So this is looking down a leg. Obviously, we can see sort of this whole shift of the hoof going this way, going this way. So this is one way of dealing with rotational deformities, where what we're trying to do is support this side by pushing the shoe further up this way to get it in line with the coronary band. So you can see the hoof should be way out here, but it's not. So we can do it this way. That's one way of doing it. And you'll notice that the shoe's ends don't come to the same spot. And we're going to talk about this. This is done purposely. We also warned the customer we're doing this, because I lost a customer because I didn't tell them I was turning a shoe on the foot and they thought I was drunk. So here's a shoe on a foot, and it looks like it's fairly normal shoe. Pointing straight up. And you can see if we draw some lines here, here's the back of the shoe, the back of the bulbs. The red line divides the frog in half, and this is the leg, the yellow line, the middle of the leg. So, and here it is on this one. Now, what you can see is what we've done is we actually turned the shoe. And so you can see here's the middle of the leg, and then here's the frog. And by turning the shoe, we're closing the gap. The shoe is not going to be in the same place at the end. So to better visualize that, here's a picture of this hoof, and I drew a magic marker line straight down the middle of the frog. And you can see where the hoof points? It's way out here. The hoof is not in line with the leg. I'm directly underneath this horse. And you can see the hoof points way out. And so if you put a shoe on directly in the middle of the hoof, which most farriers do, and I just put a line there to show you where it was on the shoe, you can still see that it's pointing way out to the side. It's pointing way out to the side. So this doesn't help the animal's rotational deformity out, and doesn't help the consequences of the loading on the heels that are differently.
Esco, I have one other question on that previous picture. So looking at what you had shared with us on how to assess, how to pick up the limb and look at it, and knowing that there is some distortion, how do you account for the distortion when the foot is in the cradle when it doesn't line up? Because it won't line up in the cradle, is that correct?
Well, the cradle is directly underneath his elbow.
So it should be lined up the way that you
Yeah,
assessed it. Okay, I just
yeah,
wanted to clarify. Thank you.
yeah. And so, you put this shoe on. What we're going to do here is turn the shoe. So notice that the magic marker line on the shoe is in a different place now. And so so here it is straight on, here it is in a different place. And you can sort of see now that the shoe is now pointing better towards the limb. So when we draw lines, you can see now the shoe is now more in line with the limb. Instead of shoeing the hoof is just the medium the farrier works in. We're shoeing the leg. So by turning the shoe, we're eliminating the consequences of one heel run forward and one shoved up, but we're putting the base underneath the leg of the animal.
It's interesting because I don't see farriers do that very often.
Yeah, that's been in farriers' books for 100 years too.
I think somebody had a question.
I can't see if someone's got a question. Anytime anyone wants to speak, just unmute and open your mouth.
How much do you decide to rotate the hoof to start? Like, do you do it incrementally or?
The hardest part about rotating the shoe is not how much you rotate it, it's how much you can turn it without losing nailing. So what happens sometimes is if you turn it too much, these nails may be outside the hoof. And so then we have to repunch nail holes in the inside of the shoe to make it fit. So it depends on the farrier skill. If they got a forge, they can repunch the nail holes. If they don't, or you don't want to do too much, then you can turn it as much as you dare to get away with nailing. Did that help you out?
Yes, thank you.
You're welcome. But you can see now we put the shoe underneath the limb. The better that shoe is underneath the limb of the horse, the less the muscle cost is going to be, which is transferred throughout the entire body.
I also want to add on to that. When Esco was talking about making these changes in the hoof, as a body worker, if you make that referral and then they make those changes, that is a really good time to go back out and follow up with your client and help relieve some of the strain that's occurring from all of those changes. Same thing when they have their teeth done. Those are good follow-ups.
The big thing is get back here, trying to find where everyone went. I minimized one screen and I don't know where you all went.
I don't know how to help you.
Yeah, it'll take a lot. Because now I can't see anybody. Because I minimized it or I hid it or something. Let me just see.
And I can't see on your screen there. I think if you hit Zoom again, it should pop them
On
up.
January 6th, end Trump's threats to democracy.
Diane, we got your background.
We know who Donald Trump is. He is.
Thank you.
Don't see where the, oh, here we
You're-
go. Participants, I'm under participants. No video, audio, show meeting. There we go. I got it. Show meeting. There we go. So the, what were you just talking about?
Do you want me to stop your screen share, Esco?
Yeah, I think we're good with
Okay.
screen share unless there's things. The important part, obviously this is best done in person. When I'm working on a horse, there's amazing amounts of things I can do that you can immediately feel in the body of the horse. I've taken horses at the clinic that we did that Christina was there and just removed a flare on the outside of the horse's foot. And not only did it bring the leg under it straight in line, but it totally relaxed the musculature system in the horse from front to hind end. And that's the real, yeah, it's really an important part to understand is how much a farrier can change that body. And that, and you know, it's going to be a difficult thing for you all because you're coming in and working on sore horses and working on musculature, and you may be chasing your tail because of what the farrier is doing. As one example, you certainly can be chasing your tail for what the owner is doing and other things. Excuse me. And so working at identifying the insult is going to be the most important part for you all, is where is this muscle issue coming along from? Because if it is in the feet, you're going to have a different conversation of how to change that. And, you know, certainly I got ideas to help you with that. But it's not going to be an easy thing.
I definitely recommend you guys get his book, like visit his website. His book is very, very helpful, I find. Esco, when you talk about like causation, you know, I read a ton of research as far as craniosacral therapy goes in terms of, you know, pullback injuries and damage to the cranial nerves causing club feet, which then you have to work, you know, obviously on what caused it. But in addition, you have to still work through the symptoms, the feet. How often are you seeing where the feet are the cause, or is it almost mostly coming from all of those other, like horses being stupid, the way they're being ridden, you know, all the various things that go on, environmental factors, etc.?
For me, I'm seeing about 2/3 of issues in the body coming from the feet.
2/3, guys.
Yeah. When we did one research, when you were talking about cranial sacral, my daughter was born, quote unquote, a colicky baby. And I had a very interesting doctor, and he says, oh, he said, your doctor's going to tell you your daughter's colicky. She's not. There's no such thing as colicky baby. And he says, I've done much research in this. He says, when we take MRIs of babies, we find microfractures of their shoulder. And it's how they're dealing with the pain and stuff. It's from the birth wedging going on. And he combined with some of the stuff I learned in chiropractic from Zink's compensatory pattern, which I tell you all to look at. Zink was looking at twin studies with scoliosis and found out that in utero lie creates a lot of birthing issues. Whether which side of the baby is going to be overstimulated. So in the last trimester, when the baby flips around in the human body, or in a foal when the hind legs are up in the horn, they're not laying perfectly back on their back. They're laying to one side or the other. So what happens is they're getting overstimulated. And so they come out with body measurement issues when they're born, where one side of the body is micromillimeters larger than the other because of overstimulation. And what he found out was with that, and when you look at limb length disparity, roughly 60% of the population has a limb length disparity, functional limb length disparity created because of muscular indifferences. And and then of course there's a lot of studies of how much you can have before it's relevant and stuff. And that's where we took that off in horses and started doing our own studies when it came to club feet, because for hundreds of years farriers just keep doing the same thing and a club foot doesn't change. And I have taken club foot for people for horses underneath 5 and 6 years old and make the club foot completely go away, because it's not a foot issue. It's always a scapula issue where the scapula is not in line with each other. And it's just the feet compensating. That's all it does is compensate. You watch a farrier chop down the heel of a club foot, the animal's not doing too well, but they'll grow that heel back quicker than any horse I've ever seen grow hoof before. Because what they're trying to do is grow that back to try to level out their scapula. So it got me thinking and be like, okay, how much heel, if you don't never trim a club foot, how much heel can you grow? Well, it stops at some point. It doesn't keep growing and growing and growing. It stops. Well, why does it stop? If you chop it off and it grows back, why does it stop? Well, it stops.
Because the scapula is balanced with the compensation.
The scapula is balanced. Now that's not good for the phalanx angle or the toe with the coffin bone, because now it's more upright, but it balances itself off. And so taking the human part of it is like, well, stop taking the heel and lift the leg up, just like we do with humans, with people who wear lifts for the exact same reason in their pelvis. And lo and behold, it started working. And so we spent a lot of time studying birth wedging and in utero lie to the point where we can actually predict which side of the animal is going to have a more upright foot or different musculature when it's born, because it's easy to be able to figure that out. Doing something about it is easy enough too. If you recognize it, you can do something about it. One of the largest thoroughbred farms I worked on would drop around 50 or 60 foals a year, and allowed me to experiment on half of them doing it. And after a couple of years, they told me stop experimenting. They want all their horses fixed, not half of them fixed, and so we had to go and stop that. But it showed that we could do stuff, and the earlier the better, obviously. And that's why we push for young horses being worked on early to change a lot of these postural issues. Also, trying not to have them work on the track before they're 3 and 4 years old, but that's something it's like pushing uphill, trying to get that changed.
Would you mind chatting a little bit about the best way to approach farriers when we see these types of insults? Like we've chatted about, you and I've chatted about, most farriers are not very open to any kind of suggestions. Would you mind sharing how the best ideas to approach farriers when we want to see some correction because we keep doing the same thing over and over again.
Yeah, the first thing is buy yourself a very powerful taser and just tase their ass. And while they're down, just keep talking to them and keep tasering them until they get it. That's what it's going to feel like. The easiest thing, because of the egos you're dealing with, is not to the vet should learn this, and not all of them do as well, is not to address it like, you know what, you need to do this change because I'm seeing this in the body, because that's sort of telling them what to do. Okay.
Yep.
That doesn't work too well. What you're trying to do is, and maybe a farrier may ask, well, what do you think I should do? And you'd be like, well, I don't know. I'm a body worker. This is your realm. Is what you're trying to do is incorporate, listen, I'm seeing a lot of tension in the longest muscle right at the base of the sacrum every time I'm here. And I think some of it could possibly be coming from the posture of this animal, the way it's standing. Is there a way that you as a farrier can look at trimming and or shoeing the animal differently that could possibly change that or ease that? What ideas do you have? Try to incorporate a teamer approach with that. Unfortunately, most of the time it's going to be looking at like deer in the headlights. They're just going to look at you like, I don't know, which would be unfortunate. But and a lot of times they're just not going to care. They're like, yeah, if you want something done, just tell me, whatever. But that's not your role either, because you get into that, stuff goes wrong, you're going to be blamed as well. When you're working with another professional, it's not necessary. I mean, you can give out ideas and stuff like that, but it's mostly it's getting them to think what they need to do differently. It's not an easy discussion. If most of you are from out west, I'm assuming it's going to be even harder than the east side of the United States, although we got some jarheads on this side too.
I think that's a status for the equestrian industry. There must be a good number of them.
Yeah.
If you work with horses, you got to have it. What questions do you guys have for him?
How often would you suggest to get radiographs of the feet and the legs?
I minimally tell people you should at least have yearly radiographs done. And the reason for that is to be able to assess over time. It's no different than, it's like a yearly physical to make sure things are going in the right direction. The other thing is making sure they're taken right and make sure they're taken at both feet. Often vets will come in, if the horse is lame on one foot, they'll take pictures of like the left front and say, oh, this is going on, and da da da. It's like, well, where's the right? Well, I didn't take any. He's lame on the left. Take the pictures of the right too. And then when you look at them, it's like they look identical. So how is it this issue when they're both have the same issue going on? So, but yearly radiographs, if you're dealing with something like laminitis, taking them every 5 weeks or 4 or 5 weeks to progression until the animal is stable. But typically, I would say yearly, so you can look at that kind of stuff.
And you start those radiographs when they're foals, like getting that baseline?
Yeah, if there's something going on with the foal, we'll take it at 3 and 6 months, usually otherwise at a year old.
Okay. I think Chelsea had a question as well.
Yeah, I have a question. I have a mare and I have her trimmed every 4 weeks. It's consistent every 4 weeks, but she does not grow a lot, like toe wise. Like when my farrier comes to trim, he trims very little off of her. And I've asked him, like, is this, like a nutrition issue or what is it? Because Her feet are solid. She doesn't have shoes. She's completely barefoot. That's how she's been since I purchased her as a 3-year-old. She's 7 now. So she's always been barefoot, and she just doesn't grow a lot of toe. And I didn't know if that would be like a nutrition issue or
No, a lot of people, well, first of all, when you're telling your story, it reminds me of a customer of mine. I would trim her horse once a year. And I'd literally come in with just a rasp and barely touch the feet. And it was a mare. And I was like, and she was like, I think I should breed this horse. I was like, don't breed that bitch. I do not need horses out there that grow feet that I only need to trim once a year. That's for darn sure. A lot of times people look at, oh, it's got to be nutrition, it's got to be environment, it's got to be this and that. But remember that the horse only grows about a 1/16 of an inch of hoof in that time period that you're talking about. And it could be wearing off that 1/16 of an inch by that time. So the farrier is barely doing anything, although barely can change a lot. But so it could be just the substrate or your environment you're living in that's wearing it off. And what you do is I tell people it's fine, keep it barefoot, and as long as that's going fine. But if, let's say, all of a sudden you started to change how much you're performing with her, and then all of a sudden she's wearing off more than she's growing, then you have to look at alternatives. But right now, it probably means what you're doing with her, she's wearing off much of what she's growing.
Okay.
Not necessarily nutrition. Yeah, you can go in and take hair samples and hoof samples and send them in, but I think if the foot is solid, that tells you right there that probably your nutrition is probably just fine.
Okay.
Yeah,
Thank you.
you're welcome.
Anybody else have any questions?
When you were saying you would take radiographs once a year, would you do front and hind legs?
Yeah, especially I'm more interested in lateral radiographs. A lot of vets get into APs or DPs. The lateral tells me everything. You can look at the shape of the navicular bone, and then if it's not correct shape, then take skyline pictures. You can look at side bones because you can see the collateral cartilage, which is ossification, and if there was some, then take a DP kind of deal. You can look at the phalanx angles. You can also look at how much loading is occurring in the heel and stuff like that. So I put more stock in the laterals. It tells me a lot more. And just because I was trained in radiology as well, and then DPs are certainly helpful, but unless you see something in those, that's, so you're basically taking 2 films per foot. So 8 films total. And unless something was suspicious, then you could take some more if needed. But I would do at least laterals every year.
Anybody else? Ask him while he's here.
Yeah. Anything about farrier work or anything. All I can say is, being a farrier and then doing like the clinic for ATT, a lot of body workers got to see how little it takes to change the body of a horse with correct farrier work, and a lot of issues can just melt right away. But that's going to be your tough part is if it is a farrier issue, is how to address that. And there's no simple answer to that other than becoming a farrier and doing your own farrier work and body work.
You had given me and us that were at the conference a pretty good tip, and this word has worked pretty well for me since then, is asking farriers. And I start off with like, is there anything that you can tweak? Because I feel this. The word tweak, I don't know what it is, but Esco, like the ears of them perk up like they're interested in a problem solving scenario. And that's been a good way for me to
Yeah.
approach it. But it's still kid gloves. I mean, it's still kind of navigating a minefield, I think, with the ego for most. I mean, even my own farrier doesn't like me making suggestions, but I did, and we got some pretty strong corrections, only to
good.
find out that his was a nutritional issue.
Yeah. Now the you know, a lot of people assume it's like an old time radio station where you just punch in the numbers and go to the radio station. Well, you know, it used to be we had to fine tune our radio station, so you're constantly tweaking the fine tuning thing as you were driving down the road to get your radio station just right so you could hear it without fuzz, sort of like before digital TV kind of deal. And so horses, you never get a horse where you want them. It's, you know, my family are car racers from Le Mans down to dirt tracks. And, you know, it's constant tweaking in a race, changing pressures and tires, changing this, that. You're constantly tweaking the horse. You're never going to get it exactly right because performance change, the horse changes, and it's going to be never ending. Your body work is going to change, how you're dealing with the horse for what it's doing. And you'll know when you're like, if you're in dressage and it goes from level 1 to 2 or 2 to 3, you'll notice the differences in the muscle structures that is occurring. Because you'll feel different things being used and stuff. So it's constantly tweaking.
And what he's just said, guys, I think is important in the way that we educate our clients, because every single visit, your client is going to ask you, well, how soon do you need to come back again? Oh, what are you tweaking? What are you changing? What's different? And all of that comes into play. And we've talked about that, you know, my goal here is to teach you guys not to do a routine. This is why, because it's a constant, ever-changing, fluid environment. Every day is going to be different when you go out to work on that horse. And the teamwork with a farrier, with a chiropractor, with a vet, all of that, I mean, you guys can be a very integral part of the horse's health.
Yeah, not getting in. Some owners, because of the way they look at services, they may think, well, if I get them massaged once or twice, the issue is done and gone. A friend of mine, Jack Marr, he used to work on football players and then worked in horses, and I've known him. And you're constantly working on sports figures all the time. There's never, you know, you're done. You don't need it anymore because they're constantly being worked on. Yeah, you're going to have some horses that get called in and it'll be once or twice, and that resolves most of their issue because they're pasture pigs or not doing much. But performance animals, you're going to be working on all the time. So it's letting your customers know that it's maintenance that needs to occur all the time in order to keep their animal performing at the highest. And it's not a one and done kind of service.
And if you're solving a problem and you're working with a farrier and making corrections, you're going to be constantly out there working to help relieve strain and things as those changes take place. Even if the horse is relaxed, there's still extracellular fluid. There's all kinds of things going on in the body that you can address to help improve performance. Brandy, you had a question?
Amen.
I did, and then I lost it. And honestly, you've taken like half my questions that I've written down, so I just let you keep going with them.
Sorry about that.
You're good.
You're too young to be losing your questions.
Any other questions, guys? that you guys have for Esco tonight?
I have one more about radiographs. Do you find it's best to take them at the beginning of the shoeing cycle, like right after you trim them, so that you're seeing what you've done, or do you like to look at them at the end to see how the horse is?
Well, fortunately, because I have my own equipment, I do before and afters. But if you didn't have your own equipment, I would have it done right after. To do it beforehand, you can say, okay, I can see we got to do this, this, and this, but then you do it, but you don't know if it's changed it. So the farrier normally doesn't work with radiographs. You have him do all his work, and then the radiographs right afterwards, you can then look at it and say, oh, all right, I needed to do more, or that's perfect, or whatever. So it's better if you're going to do it that way to do it right after the farrier work, because they're going to assume if you did it before, they got it correct.
Okay, perfect.
Yeah.
That's a great question.
Yeah, always try to get the radiographs on the freshest feet. So a lot of times when I come into horses, because I do a lot of consultations, I'll be asking questions. One of the questions I'll ask is, what date was the farrier there last? And of course, they'll say, oh, 5 weeks ago. And it's like, okay, what was the date? And then you find out it was 2 weeks ago, because everything's 5 weeks ago. But it matters because you want to look at, if I'm looking at a hoof and it was done a week ago and there's major imbalances, then that's a problem. But if I'm looking at a hoof that the farrier is going to be showing up next week at 5 or 6 weeks, and it's been that amount, well, that imbalances may not, it could be somewhat the farrier, but it also could be how the animal was used. It could be its postural issues that it's got going on, or body issues. So there's a lot of things that interfere with that. I can't, if it was just done, that's why when I try to consult within a day or two after you're done. So if he's way out of balance, I can say, okay, this is farrier, because you can't grow this amount of hoof from being, other issues. So, that's an important fact when we're consulting on animals is as close to when it was done, the best.
Awesome. Thank you. Anything else? Any other questions?
No, I think Christina was working on trying to get me out to the school at some time so you could see it all in person sometime. It'd blow your mind.
Definitely want to get you out. I've already had some chats going, hey, can we do this?
There you go.
So we'll coordinate that. And Esco, is there anything you want to leave everybody with? Any nuggets that you have?
No, body work is an important aspect of things. I always promote education, so getting as educated as possible and continue your education, whether that's joining different organizations like AETT or other organizations, but continue your continuing ed and keep track of it. Bless you. Farriers aren't required to do any continuing ed, but I keep track of all my continuing ed. I roughly do between 90 and 200 CEs hours a year, and I post them every year so people can see them. It's real important to do that. Yes, you're required to have certain CEs or whatever, but write down and keep track of all your continuing ed. Even right now, you would say an hour and a half of listening to blah blah. Keep track of that, because one, so you can use it for self-promotion, but two, Lord forbid if you're ever in litigation with anything, the more documentation of your training and what you've learned, that will help you out. I'm used as an expert witness in lawsuits all the time because of my education and my status in the industry. And often will come up as, when the cases involve farriers is how much training do they have? And they can't prove that they have any. Oh, I went to farrier school. Well, I go to a yearly convention and that's it. There's no list of what they do and stuff like that. Not that you ever want to be in that situation, but it's better to be prepared. You know, sort of like what your mom says, always go on out with a clean pair of underwear because you never know if you're going to get in an accident, you know. So just be prepared for that stuff.
And that continuing ed and documenting it it's critical for a lot of things. Like if you go to apply for some insurances, things like that, they're going to ask you. I mean, I've had to provide my continuing ed to get cryotherapy coverage. I've had to provide so I've had to show it as proof to sit for the NABCAM exam because when I started, none of that existed. So I've had to document it. So definitely keep a record of all the things that you do. You'll need it later, even if you think you don't need it today. Esco, anything else you want to add, or are you all set?
I think they all fell asleep.
They still, those two spaces I can see still look like they're pretty perky and paying attention, but I know it's getting late on your end. Thank you for coming on and talking with us. I really appreciate it, and hopefully you'll see more of these faces soon.
Yeah, and I promote you all to look up my Facebook page, Esco Buff. It's got a heart bar shoe on it as my business page. Lots of cases there that you can look at and see for farrier cases. And if you got any questions, just get a hold of me.
It's very interesting. Esco, thank you so much.
You're welcome, ladies. You have a good evening.
Thank you.
Thank you.
Thank
care.
you.
You're
Thank
welcome.
you.